Thank you so much for joining us today. On behalf of Sukoon family, we are really honored to have you here, sir. So to all of you, thank you joining today for this session on No More Falls, Simple Steps for Senior Safety by Dr. Saravanan. For those of you who don't know about Dr. Saravanan, he's a geriatric medicine specialist trained at AIMS. He brings nearly a decade of expertise in elder care, including falls prevention, rehabilitation, and holistic assessment. His work has been presented globally and he actively contributes to advancing geriatric medicine. Sir, once again, many thanks from the team, and we are really honored to have you here.
Thank you, Sukoon. Thanks you for your generous words, and thank you, Sukoon, for giving me the opportunity. And I'm happy to meet you all. And I thank you for whoever joined, taking their precious time. And we can go ahead.
Sure. So, those of you who have joined us for the first time as well, uh, wanted to share a little about what we do at Sukoon and who we are. Um, so at Sukoon, Sukoon means peace, and here we are for our senior citizens to make a happy space for them. Basically, we are India's first community for the seniors by the seniors. We are spread across 50 plus cities. So, moving ahead now, sir, like I would like to continue with you. So for this session, is there anything particular that you would like to begin before we start our call today?
Yeah, I would like to talk about falls only. And
Hello?
usually, hello,
Yes,
hello.
ma'am. Okay. Sir, I think you can continue.
Yeah, today we can talk about falls. Regarding there are lots of myths surrounding the falls that falls are part of normal aging or a part of aging, which is not. So it's often considered as I fall down, I'm aging. What about that? What about that? So it is not that. And the falls has its own implications and own complications. And the falls is very common. Around one in three elderly, like 30% of the elder people more than 60 years of age experiencing falls. If the age increases to 80 years, around 50% of them experiencing falls. Means one in two elder adult over the age of 80 years experiencing the falls.
Okay, sir. So, sir, talking about falls, what are the most common risk factors for falls in seniors, and how can they be mitigated?
Yeah. What is the risk factor is it is there are some factor present in us or in our environment which can develop into a problem. Falls is not a linear cause, like it can be due to multiple problems. There are it is multifactorial as we see, as we will say. Falls can be due to weak muscles, poor balance, poor vision, poor hearing impairment, difficulty in the hearing, and dizziness, lightheadedness, sometimes due to loss of consciousness, food problems, memory issues. So these a lot of these causes can contribute to the falls in the elderly. Yeah. Am I audible?
Yeah, yeah,
Yeah.
Okay.
Yes.
Hello.
yeah.
Yes, sir. So I was asking that how can we make a home environment safer to prevent falls, and what are the top three changes that you would recommend?
So top three environment, first environment I would like to address is the bathroom because most of the falls will happen at the bathroom only. I would like to urge the elderly to install the grab bar right next to the toilets or rest next to their showers, and then put a shower mat, non-slippery shower mats under the showers. Then we can install a wall chair or seating chair to take bath while sitting. And the second thing is improve the lighting into your home because some of the lighting or some of the walkways will be poorly lit, which can leads to falls also. The third thing, the falls can happen at the bedroom. Most commonly, the falls will happen while getting up from the bedroom and going to the bathroom. So the gap between the bed and the walkway should be adequate. And I would urge the elderly to keep a call bell or some kind of bell or something to call for help if they want to go to the bathroom in the middle of the night.
Right, right. Also, to everyone else who has joined the session, in case you have any queries, please feel free to ask. You can also mention your question in the chat box. So we are going through a discussion, and if in case there is any question, you can maybe ask once sir is done, or you can also mention your questions in the chat box. So moving ahead next, so far we don't have any questions from anyone. So moving ahead, what role will the medications play in increasing the risk of falls, and how can uh, this be managed basically?
So first thing is one size doesn't fit everyone in the elderly. We cannot stop all the medicines. Whether the medicines can cause falls, definitely some of the medicines related to falls and can cause falls in some older people. So what are the common medicines causes falls? So first one is the sleep medicines, causing the lightheadedness, spinning of their head, and they can fall down. Then there are something class of medicines called narcotics. Then some classes of antidepressants, anti-anxiety agents, some classes of BP medicines can induce the falls. So if you have a fall and you are taking 5 or more medicines, you may need a medication revision. So taking 5 or more medicines, we will, the geriatricians or the elderly senior care physicians, we call it as a polypharmacy. That is taking more medicines. Sometimes these can be associated with along with other factors responsible for the falls. The patient may need a medication revision. So I would like to recommend to if you experience a falls, you are taking 5 or more medicines, ask them to go to the nearest geriatrician, that is a senior care physician, and take their consults. They will examine you and they will make a medication revision also. If necessary, they may change the medicines or decrease the medicines according to the examination results or the after the assessment.
Okay, okay. Thank you for letting us know that. To everyone on this webinar who has joined this webinar, please feel free to ask questions. You can unmute yourselves and ask directly to Dr. Saravanan, or if not on the call, then you can also write your questions in the chat box. I will address them as well. Moving ahead, sir. So, what are some of the warning signs that indicate an older adult may be at increased risk of falling?
Okay. When if the older people experience the falls, the risk of falling again will be high. Likely to experience one fall again will be high in the first 6 months. So if the elderly had a fall, or they are having a fear of falling, like more than 50% of the older adults having the fear of fall. If you have fallen down or having a fear of falling, should or at increased risk of falls, or while you are getting up from sitting down position, you have difficulty in getting up or unsteadiness during getting up, you are having a higher risk of falls. This is a self-assessment. So if they are having any of the three, they can go to the geriatrician. They can go undergo an assessment.
Okay, okay. So I think Rajni ma'am has a question. Please do ask, ma'am. Kindly unmute yourselves.
Hello, doctor. Can you listen me now?
Yes, ma'am. Yeah, I can hear
Okay.
you.
I am patient of some neurological problem. They are not able to make my complete diagnosis, but there is atrophy in my head, cerebral atrophy. You can see that. Can you hear me?
Yeah, I can hear you.
Yeah, I am a patient of Nimhans. I go to
Okay.
Nimhans, Bangalore. Okay. So,
Okay.
okay, previously they made my diagnosis as MSC,
Okay.
MSC, but this time they said that MS is not there, CA is definitely there, but MS is not there. So we are back to square one regarding my diagnosis, and they held a genetic test also of mine.
Okay.
But I am very, very prone to falling. I have become very prone to falling because I can't walk properly, you can say, and I lose balance.
Okay.
And that can be due to my poor vision. Also, my corrected vision is all right. Okay.
Okay.
But overall vision is blurry, little blurry, you can
Okay.
see. Yeah. So
Uh,
what will you suggest? I am on Sindopa and Parkitidine.
okay. Thanks for your query. I need to I need a complete examination first, and I need in person, and I need to undergo has to go through your records. Then we have to devise a plan for you and physical therapy and other therapies. So without physical examination, it is difficult to ascertain what is causing the falls, because fall is not due to can never be due to a single cause. So
No, no, no.
so
Because doctor said it is due to atrophy. My cerebellum is shrinking.
okay.
Okay,
If
and
it
he
is
said
one
that
cause, it can lead to balance impairment.
Yeah.
But
Yeah. Balance
can,
impairment is there.
yeah, there are balance exercises to reinforce that. Before that, I
I
have
do,
to give you
I
other
do
questions.
exercises daily. I do my physical exercises daily, once in morning and once in the evening. That heel to toe walk, that retro walking, and then balancing myself on one leg, and then close my eyes and just join my legs and standing there, closed eyes for 1 minute.
Hmm.
These exercises I perform daily.
Okay, please continue that.
Already.
You will get better. Don't worry.
Thank you.
Thank
I'm just, because when I fall, my husband is, I'm a businesswoman here. So I have to face many female customers also. They are unwantedly, they just inquire about me, when what happened to you. And then my husband gets worried, ki, okay, if she falls and if she has a fracture, then that will become primary. Obviously, that becomes primary and I am bedridden then. I'm 62 years old, 61 years old, not 62, 61 years old.
Okay. And that's no need to worry about those things. Just tell them you are all right. Just you will be in good health in 6 months. Please continue the exercises. That will do.
Okay.
Yeah.
Thank you. Thank you. Thank
Thank you
you.
so much, ma'am, for your
Thank you.
question. Sir, we have another question in the chat box where Shivakumar sir is asking, engineers do failure analysis after accidents happen worldwide. Like this is there any research to educate people based on Vani Jairamji last year and last week Indra Rajanji fell down and passed away.
It is, as I told, what you asked me, what are the top three things you will recommend? I recommended the bathroom. So Indra Rajan sir fell down in the bathroom only. So install grab bars, seat, and these things. Put a non-slippery mat and take precautions. And we will discuss the other things further down. So these are the things has to be taken care of. These are basic things to be taken care of. And falls can cause sometimes serious injuries. Serious injuries are like one is fractures of the hand or fractures of the hip or fractures of the spinal cord. Because as you age, the bones become normal, soft. We call it as osteoporosis.
Osteoporosis.
Osteoporosis usually stays silent. Sometimes in older people, the first sign of osteoporosis is a fall, is a fracture after a fall. Sometimes fracture will be the first manifestation. Other serious injuries can be whether how they are falling down. If they're falling on their head or something, it can lead to impact. Impact it can lead to bleeding inside the brain, and all those things can happen.
Yeah, sure. Thank you, sir. Sir, thank you, Shivakumar sir, for your question. Now moving on to the next question, is that how often, like Rajni ma'am also mentioned, so how often should seniors be assessed for fall risk, and who should conduct these assessments?
A well-trained geriatrician or a person who has exposure in geriatrics, well-trained in fall assessment, can conduct the assessment in falls.
Okay, okay. We have another question in the chat box from Mangalam Ravindra ji. So he is asking that is bone density test mandatory for elders to avoid osteoporosis?
It is when to screen. It can be used as a screening test. Who to screen, when to screen. So above 70 years, all the older people can undergo a specialized scan called DEXA. It will measure the density of the bone, how thick the bone is, how soft the bone is, and it can give the result. Based on the results, patients can be treated with the medicines, exercises, and other things. Or if
Excuse
you
me.
have a premenopausal or surgical menopause, as in medical terms, like patients may be before the age of 40 or 35, something like that, there will be their uterus may be removed due to various medical reasons. They will be having early osteoporosis. In those patients, we can start the screening bit early, maybe 10 years or 15 years before that.
Okay, okay. Thank you, sir, for your answer. Thank you, Ravindraji, for a wonderful question. Next, I would like to ask that what should seniors do immediately after a fall to prevent, further complications?
First thing, if you are not living alone, you call for help. If you are living alone, keep your mobile or something in the bathroom or somewhere so that you can ask for help. Okay. So the second thing is don't let it go because there are silent things like this fractures are silent. Immediate after a fall, visit the nearest hospital. If you can access to the geriatrician. If not, go to the nearest hospital, check your physician that you have any problems like vision and everything. They will check and they will give you assessment. Yeah. This is important to rule out grievous injuries. I have stated here. Grievous injuries. I have serious injuries. I have stated earlier.
Thank you. Okay, okay. So are there any technological advancements or devices that can help prevent the falls or alert caregivers when a fall occurs?
There are devices like Apple Watches and are there, but they are mostly into they can view in the location and the patient is lying down and all these things happening in US. But Apple Watch can detect yearly abnormal heartbeats yearly, so it can be amended because abnormal heartbeats can also cause falls. And to date, there is no technology, nothing can prevent falls. That wearing a hip protector and everything. But hip protector or any other devices can help in decreasing the fear of falling. So it can improve their mobility. That is what the research says till date.
Okay, okay. Thank you, doctor. So next question we have is from Mr. Sandeep Mohanty that how can osteoporosis be delayed? Fracture being a major danger of a fall of a geriatric.
Exercise, adequate protein intake, and maybe calcium and vitamin D intake. If you are deficient, exercise is the key, and adequate protein intake is the key. And it should not be started after we become geriatric. It should be started in the middle age or little bit earlier before we entering into the healthy aging region that is more than 60.
Yeah, okay. Thank you for the answer. Thank you for the question, Sandeep ji. So next we have is okay, we have another question from Murchana Panigrahi that can you suggest some balance exercise?
We have to assess, as I told before, one size doesn't fit everyone. We have to find what is deficient and deficient or which domain is deficient. We have to suggest exercise for that. There are frailty also built there. So we cannot give one exercises to every older people that you can follow. Common exercises I would to recommend if you are healthy, older adult, able to go and come back and do everything, just do something called resistance exercises. Learn under supervision of someone and till you are able to do it independently. Then you can do some exercises called sitting to standing exercises. Sitting to standing exercises with resistance, with support, without support. So one leg balance test with support, without support, eyes closed, eyes open. There are a lot of variations are there. Anyone trained to physiotherapist or exercise therapist or exercise physiology who are trained, they can teach you these things.
Okay, okay. So I think we have quite a few more questions in the chat box. Gurunath Reddy is asking how to identify osteoporosis.
Yeah, DEXA scan. We
Sorry?
got there is a specialized scan called a DEXA scan. So
Right.
underline
Okay.
can undergo it.
Okay. Thank you. Next is does physiotherapy help?
Physiotherapy help in improving the mobility. If mobility there is moving around inside the home, outside the home, or balance issues, physiotherapy can definitely help.
Okay. So the next question is that the calcium is not recommended, but D3 is needed weekly. Anything else to add on? This is the
It
question.
is not like that. Calcium is not needed. We cannot give a cannot discount like that because there are very technical things. If you are osteoporotic, D3 alone cannot supplemented alone. So it varies according to the condition, according to the medical conditions you are having and other things. We have to measure and we have to supplement it. And D3 as a routine is also not recommended for everyone and routine supplementation. There is no benefit.
Okay. I am not able to understand the other question that have come from Rajni ji. Physiotherapy. You have just written physiotherapy, ma'am. No, no, you're on mute.
Physiotherapy I have written because I wrote that physiotherapy word wrong in the previous chat. Physiotherapy is a, that's why I repeated that. No,
No
not a
problem, no
question.
problem. Thank you, thank you. So Sandeep ji, you have written apart from drugs. Would you like to specify your question here? You could unmute yourself and ask.
Maybe he is talking about the calcium vitamin D supplementation or something like that.
Okay, okay. So next question we have is from Mangalam Ravindran ji. Is sodium blood test mandatory to do along with regular health checkups because older adults are more likely to have severe symptoms?
No, no need. Unless you are taking some medicines which can decrease sodium or something, you can screen. Otherwise, there is no need for screening routine sodium or take sodium test for all elder people.
Okay. So, doctor, I have another question is that how can seniors build strength and confidence to reduce fear of falling while maintaining independence?
To reduce the fear of fall, so to reduce the fear of fall, they have to build a community or home environment. Then they have to build the strength of the muscles and adequate review of their medicines and optimal medicinal uptake. Then the exercise therapy, adequate exercise, optimal recommended exercise needed for that. And if you are immobile, like you'll be losing muscle. And there is a quote like it take 1 year for the children to obtain all the milestones. It only need a fall for the elderly to lose everything. So it is like that. So staying put and not moving around will not help in preventing falls. It will actually paradoxically increase the falls. So have to move around. So for what is needed to move around, muscles, nutrition, optimal medicine optimization, and increase the home environment optimization. So all these things should come together to and decrease the fear of falling. Once the fear of fall decreases, patient can be or the elderly can be moving around with or without help.
Okay, okay. And can vision impairments impact the fall risk? Like, how can these be addressed effectively?
Yeah. So definitely vision impairment can cause falls. At least I would recommend all elderly should undergo yearly once for their vision checkups to sort out common problems like cataract or glaucoma, which can be due to the increased pressure of the eyes. And I would urge the elderly to not use the bifocal lenses. Bifocal lenses can increase the fall risk. And while going for the hospital, majorly they will examine for the long vision only. They should examine for the near vision also. So both vision should be examined and both should be corrected.
Okay, okay. There's another question we have from Gurunath Reddy ji that does staying in AC room result in vitamin D deficiency?
Not really. It doesn't make any difference. You are going out, walking in the sun, and increase the vitamin D and everything. Of course, it may be some effect, but it is very negligible effect.
Okay, okay. So I have another question that how do social factors such as isolation impact fall risk? Uh, and how can we support seniors in maintaining social connections?
Okay. The first thing is social isolation can be a very big problem. One thing is if they fall down, they will be not be having anyone to call, and sometimes elderly will be going out walking with the friends or some companionship. So due to that, they will not move around. So their mobility is decreased, and it will lead to increased falls. To decrease fall risk, you got to move around. You can. There are senior living communities, and everything is coming around. You can form a community inside and senior working groups. At least I know two or three working groups all over 60 daily. They will gather, they will some stretching exercises, they will walk around for go for walking from one point to another point like half an hour, something like that. Second thing is social groups like exercise groups or some form of groups which can share stories or make things small things like soaps or some new hobbies. So this kind of social connections and the social groups can be made. So socialization can decrease loneliness and mobility, improve the mobility. So all these things can be done to decrease the falls.
Thank you. So do we have any more questions from anyone? You can unmute yourselves and ask or write in the chat. So there's a question. I am on, I don't know how to tell that. ID Rofos 150 once in a month for last 10 years. Is it harmful?
At least ideally, after 10 years, there should be a break. I don't know what are the conditions or what the medical conditions. Without looking at the medical records or examination, cannot comment on the treatment. It will be
Okay.
difficult to comment on the treatment.
Okay. Is there any more question? If there is any more question, you could unmute yourselves and ask.
Hello.
Hello.
Yes, ma'am.
Yes. Does walking barefooted every day for some time help in maintaining better balance?
I would like to. I don't recommend barefoot walking. I would always recommend a wear adequate shoes because flat foot or something can be an issue, and you may not be born with a flat foot, but with the age, flat foot can happen. And barefoot walking may increase the friction, and which may cause something called calluses at your foot, and which may cause ulcers or some problems, pain in the foot. So always please wear adequately sized, very comfortable footwears during walking.
Yeah, excuse me, but at some places, people walk barefooted inside the house. Outside, we always wear, we have, wear, we wear shoes or we have footwear, but inside the houses, at some places, people always walk barefooted.
You can wear inside chappals or inside home chappals also, because if there is a wet floors or even a wet floor can cause falls. In that case, yeah, adequately worn shoes or chappals with good grip can prevent falls.
Thank you. Thank you very much.
Thank you.
Thank you, ma'am, for your question. So just an heads up to everyone, we are going to keep 5 more minutes for questions in case we have any, and then we would be ending today's session. So if you have any questions, kindly share them in the chat box. So the next question that we have is from Mr. Ganesh Iyer, that any special care for seniors in extreme winter conditions, any medication, supplements, etc.
Avoid extreme winter conditions and vaccinate yourself for common diseases like pneumonia and the flu and all these things. Wear adequate winter clothes. There is no medicines like that. Having adequate nutrition, take adequate water, move adequately, sleep adequately. That is enough. That is the precautions to be taken during winters.
Okay, okay, so we have a question from Sandeep ji. Is there a Sukoon branch in Orissa? If so, how can one join? So we don't have a branch in Orissa. We do have some of our users of Sukoon family there. Uh, how you can join? So what I'll do is I'll ask one of our Sukoon team members to reach out to you later on, Sandeep ji. Thank you so much for all the love. If there is any question, please do ask.
Could you share some kind of information booklet about what was said today so that we can?
Ma'am, I will be so we will be sharing a summary of today's session after the session.
Okay. Yeah. Thank you.
Thank you so much.
No, if some research has been done for the cause of falls, for the cause and its prevention. It's effects we have discussed in the effects, but
Okay, that is environmental thing, adequate lighting, and there is no one single thing that we can prevent like screening and these things. One thing is medicine related. That is, you have to check your medicines. Are you on optimal medicines or for your optimal medical conditions? And home environment, that is adequately say a safe bathroom, a safe bedroom, and a safe home environment, clutter free floors, avoiding wet floors, and even a frisky dog can cause a fall. So avoid pet animals roaming here and there, and well lit bathrooms, and floors and carpets in contrast colors, and floors and switches in contrast colors. Avoid cornering tables in the tables with rounded corners in the corners, and avoiding tables or chairs in the blind corners. So like that, this list will be going on. It is between the patient and the environment and what are the conditions the patient or the elderly is having. And all these three should be optimized to prevent a fall.
Thank you, sir.
Thank,
Thank you.
thank you, sir. So we have another question that sometimes itching below the feet uh, or some feet care. Okay, I think he's just mentioning there is some itching problem on the feet. Is there any way of care possible for that?
So without examination, it is difficult to comment on. So please consult a doctor who is available to you. I am based out of Chennai in MGM Mala. So if you are in Chennai, please reach out to me. And please see
Um,
nearest doctor. It can be a skin problem, or it can be a foot problem, or it can be a biomechanical problem. May all the things can cause itching, or it could be a simple allergy due to the sock or the clothes you are wearing or exposed to. You have to identify it and we have to sort it out.
So the next, yes, and to everyone, this session will be available on YouTube in 2 to 3 more days on our YouTube channel. So you can definitely watch it again in case you missed any particular part. And also you can share with others, other of your senior friends and senior community members so that they also can get all the tips shared by Dr. today. So we'll just address few more questions before ending this session now. Any good hospital or specialist at Bangalore that you can recommend for initial consultation?
Okay, thank you. Thanks for the question. And you can reach out to Dr. Dominic Benjamin in Bangalore Baptist Hospital, a geriatrician, or Dr. Steve Paul in Apollo Bannergata Road. So you can reach out to the two of my colleagues. So colleagues who are geriatricians.
Okay. Thank you, Sandeep ji, for your appreciation. So, thank you everyone for joining today. Thank you so much, Doctor, for your time and useful insights. I think I am also taking a lot of learning today for my own family members back at home. Thank you so much.
Thank you.
Uh, in case anyone has missed, the session will be available on YouTube in 2 to 3 more days, and we will be sharing the synopsis on the events community as well. Thank you so much, everyone. Have a
Thank,
great day ahead. Thank you.
thank you.
Thank
Thank
you.
you.
Thank you.
Thank you.
Thank you, everyone.
Thank you.